Hello, everybody. I will convene us. Thank you very much for joining us. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. Welcome to this public health conversation. These public health conversations are a series that we organize here at the school where we invite key thinkers to talk about consequential issues in public health on any given moment. And we're really delighted about today's presenter and today's issue. Just to frame it for a second, we as a country have 28 million Americans uninsured and millions more Americans who cannot afford coverage. Rosemary Day, who you'll hear formal introduction of her in a second, in her excellent new book, Marching Towards Coverage, really asks the question, can we do better? And I think she offers a really compelling approach for us doing better in terms of women engaging collectively around the topic. And this, of course, is a very timely moment to be having this conversation with an election coming up, around which the fate of the Affordable Care Act and much else about healthcare access is at stake. So I'm really looking forward to this conversation, and I am grateful to you all for joining us for this conversation and for other conversations that we host here at the school. Today's event is going to be moderated by Professor Sarah Gordon. Professor Gordon is an assistant professor in the Department of Health Law, Policy, and Management here at our School of Public Health. Her research evaluates policies that affect low-income populations with a particular focus on health insurance and access to care. She has applied econometric causal inference models to assess impacts of state-level healthcare and really is emerging as one of the strongest, clearest thinkers about issues around access to care. We thought she would be the perfect person to moderate this conversation with Rosemary Day. I'm now going to turn this over to Professor Gordon. Sarah, over to you.
So much, Dean Galea. Hello and welcome everyone to this important public health conversation about the role of women in getting the US to universal health coverage. So I am Sarah Gordon, an assistant professor here at the BU School of Public Health, and I will be moderating our discussion. And I would like to start by introducing our guest and speaker, Rosemary Day. Rosemary Day is a health policy expert and founder and CEO of Day Health Strategies, a successful, mission-driven, woman-owned consulting firm. Before starting her own company, she was a founding leader of the Massachusetts Health Connector, playing a significant role in launching the first state-run health insurance exchange in the United States, which helped bring the uninsured rate down to about 2% in Massachusetts, the lowest in the country. During her tenure, the Health Connector became a model for the Affordable Care Act, our nation's most recent large health reform initiative. She has also served as the Chief Operating Officer for the Massachusetts Medicaid Program, a $6 billion state agency covering over 1 million Massachusetts residents. Rosemary holds a Master's of Public Policy from Harvard's Kennedy School, and as we will see today, she is passionate about universal health care and women's health issues. She is also a mother, a breast cancer survivor, and an activist. As Dean Galea mentioned, she is the author of Marching Toward Coverage, How Women Can Lead the Fight for Universal Health Care, which was published by Beacon Press in March of 2020. I'm now going to turn it over to Rosemary Day for her keynote remarks, and I look forward to a lively discussion to follow.
Great. Thank you so much, Sarah. I really appreciate it. And also Dean Galea for both your introduction of this whole event and your kind words on the they're on the back cover of the book, which are, I guess it's not showing up there, but very much appreciate your support of universal health care and so many of the most important causes of our day. So I am going to start with some slides, and I'm going to get a screen share going here. And I will go through a series of topics related to universal healthcare. How we're going to explore some of the feasible paths, and then get to how women can lead the way, and specifically what you can be doing in that regard. So I both my goal is to inform you about some of the issues and then also inspire you to action. I'll get started though first with explaining what inspired me to action. So let's go to the next slide. To frame things out, first of all, I opened the book with this quote, that everyone who is born holds dual citizenship in the kingdom of the well and in the kingdom of the sick. Although we all prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. And Susan Sontag, who was a prolific author, but also survived breast cancer, wrote this when she was going through her cancer situation. And as was noted in my introduction, I also had a breast cancer scare and was treated successfully, and had the occasion to spend time in the kingdom of the sick, even though I had always considered myself to be a very well person. And so what I like to convey to folks, and particularly to young people who are starting out in life, who may view themselves as invincibly healthy, that you will travel to that other kingdom at some point, as will people who you love. And so this notion of having health insurance and coverage is something that isn't just about other people. It's also about your own arc and path in life. We'll go to the next slide. So in terms of the inspiration for the book, there was both a negative and a positive. The negative was the election results of 2016. The fact that Donald Trump won and that there was a Republican majority in Congress, and that most of the leadership was speaking about repealing the Affordable Care Act. In fact, Donald Trump said that that was something he was going to do on day one. And the Affordable Care Act was, in a way, I almost considered it my baby, or one of my kids, because we had birthed its prototype here in Massachusetts back in 2006. And I was fortunate enough to be asked to come and help start the health reform exchange that was established by the law. And it was something that had never been tried in this country. And so I worked with an incredible team, and we were able to build something up that, as I say, became the prototype for the ACA. It was a bipartisan endeavor. It was a working, functional model. It was a hybrid approach. These are all themes I'll come back to. And we had huge success. We got to near universal coverage here in this state, which no other state had done before. So when the Affordable Care Act passed, I took the opportunity to try and help other states do the same thing. And that was in 2010. Here we are in 2020. The Affordable Care Act has had an extremely rocky road, several near-death experiences, and we are poised for another one. But the 2016 election, if I were a betting person, I would have thought that it would be over, that in fact the Republicans would succeed and that the law would be repealed. So I felt that I needed to do more somehow. So that was part of the impetus. What then happened was the Women's March in Washington, D.C., and all over the country, all over the world. I was fortunate enough to go to Washington, D.C. with my 80-year-old mother, my oldest daughter, and several friends, and about, I don't know, it felt like 1 million other people. It was the largest single-day protest ever in the history of the country, and it was completely peaceful and very positive and very powerful. And I mean, I'll never forget the feeling. And that truly inspired me for this book in a positive way, because it was feeling the power of these people coming together, all of us holding signs for the different causes we believed in. And many people were carrying signs about making healthcare a right, and protecting the Affordable Care Act and doing all those things. I thought, as so many women there did, okay, this is amazing. What's next? What more can I do? And of course, they were encouraging people to vote, to run for office. For me, the answer was to write this book. And particularly since my breast cancer diagnosis came right after the march, I kind of had to get through that, but it underscored for me that this writing about healthcare was going to be extremely important, and that I had more than a policy wonk story to tell. I also had a personal story to tell, and that really became all the kind of underpinnings of doing the book. So I was inspired both, in the positive and negative senses, but I tend to be somebody who wants to, as I just heard Dean Galea say prior to coming online here, dwell in optimism. And so hence this book. Next slide. again, to frame this out, as folks were talking about repealing the Affordable Care Act in the White House, this is a picture that was taken at the time in early 2017. And you'll note that there was absolutely zero diversity in this room, no women and no people of color. This is a photo that went viral at the time, and it's right about when I was having my surgery. And some of the folks were saying, some of the men were saying, why are we even paying for mammograms? Why do we have to, this makes no sense. And I thought, my anger increased. And again, I said, okay, I've got to channel this into some kind of positive direction, because we need more people to understand the value of not only Affordable Care Act, but truly making healthcare a right and finding a way to universal healthcare. Next slide. And so paying my respects to one of my heroes, or sheroes, I should say, Justice Ruth Bader Ginsburg, who I quoted in the book. I open each chapter with a quote that inspires me. And as she famously said, women belong in all the places that decisions are being made. And I couldn't agree more. And I will get into more of the reasons why as it relates to healthcare. Next slide. So first, I want to give a little bit of background about health insurance coverage in this country, and I'll go through this fairly quickly because I think many of you are informed on this matter. But just to level set, let's go to the next slide. About half the country receives their health insurance coverage through their employer or their spouse or they're a dependent in some fashion. They're a child of somebody who's got health insurance through their employer. So that covers about half the population. Then we have the folks who are covered by Medicare and Medicaid. In this chart, Medicaid is the green pie and piece of the pie, and Medicare is blue. And then we have the light pink segment, which is called the non-group insurance market. That's really actually part of what the Affordable Care Act was addressing. A significant part was people who were made too much money from being on Medicaid, which frankly isn't very much, but that they exceeded those income cutoffs. They were too young for Medicare, and they did not have a job that offered insurance. Maybe they were self-employed, or maybe they were working several part-time jobs, all kinds of reasons why people wouldn't have coverage through the employer market. And so they are on their own to buy insurance. So that sliver, which is about 21 million people, is one of the segments that the Affordable Care Act was addressing. The other significant segment was the number of folks who were uninsured. And that includes, at the time of this chart, that was 28 million people, just under 10% of our population. That number has grown to 30 million, and it is actually growing even more now because of the pandemic and so much job loss. So that's estimated to grow to at least 35 million, if not more, when the official counts are taken next year. So that's a picture of how coverage is meted out in the U.S., and it's really a kind of a patchwork situation. And there's a tremendous range. I should also just note that that half of the population that looks like that solid dark pink piece of the pie, it's actually extremely variable. Parts of it I would describe as threadbare. People who have high deductible health plans, some of them cannot actually afford to use the coverage they have. So it's almost as if they don't have health insurance coverage. So that piece of the pie looks a lot more secure than it actually is. Okay, moving to the next slide. The Affordable Care Act was notable in many, many respects. It frankly was the biggest piece of activity to get to reducing the number of people who were uninsured in this country since the advent of Medicare and Medicaid in 1965. So that was prior to then the biggest thing that had happened in terms of healthcare coverage. The Affordable Care Act was the next biggest thing. There had been little bits of things along the way, but the Affordable Care Act was significant, and it insured 20 million more people, both through Medicaid expansion and through the advent of the health insurance exchanges modeled on the one here in Massachusetts, which helped to cover people who, again, made more money than the Medicaid program allowed, but did not make, but did not have employer-sponsored coverage. So there was a subsidy structure put in place on a sliding scale that made insurance much more affordable and accessible to people. So that's a significant piece of legislation for that. Another reason why the Affordable Care Act is so significant is that it provided protection for all the people in the country with pre-existing conditions. And we hear a lot about that in relation to this upcoming election and the Supreme Court case, which we'll talk about more later, that's pending. But there are over 100 million people in the US with pre-existing conditions. I am now one of them. Anytime you've been through a health event like cancer, even if you are declared healthy by your doctors, insurers will always put an asterisk by your name because you're somebody that they've got to watch and you are at higher risk for costing them money. So what in the old days before the Affordable Care Act, people with pre-existing conditions who didn't have insurance through their job would either be charged more for their insurance, buying it on their own, usually to a point where they simply couldn't afford it, or they could be denied coverage outright because there was no requirement that insurers cover them, even though they needed the coverage. That is a tremendous thing that was changed, which means that people who might lose insurance through their job and be really worried because they have, a heart condition or a child with some kind of chronic illness or anything like that, they don't have to worry from the standpoint of coverage because they are guaranteed coverage in the individual market, thanks to the Affordable Care Act. Moving to the next slide. Why does it matter to be uninsured? There are people who still believe, well, hey, we have to provide treatment in the emergency room. So, people can just kind of rely on that and buy some medicines over the counter out of pocket. And isn't that enough, especially if you're basically healthy? It turns out that pre-pandemic statistics here, 26,000 people are dying every year in the United States because of being uninsured. And that can be for a whole bunch of reasons. It can be that their cancer wasn't detected early the way mine was, and so they're much farther along and have less of odds of survival. It can be chronic conditions that are not being adequately treated, even though we have the science and can frankly fairly inexpensively treat those conditions. And it can also just be how you're treated in the hospital. Sure, if you're in an auto accident and you're bleeding, they have to take you in the ER, but they don't have to do lots of extras for you if you don't have insurance coverage. And so there's plenty of studies that show a different mortality rate for those who have insurance coverage and those who don't, even when they're in the same exact status otherwise in terms of injury. Another really important point is that there are tremendous health disparities. Uninsurance drives some of that, but there are a lot of other contributing factors. All of those contributing factors together mean that there are about 200 African Americans dying every day in the US due to these disparities. And being uninsured is, as I say, a contributing factor. That's as Professor David Williams from Harvard put it, that's the equivalent of having a jet plane crash every single day, a jet plane full of African Americans dying. Moving to the next slide. And so I talk in the book about who are the uninsured because, data is one thing, but it's really the stories that are extremely important, I think, in terms of creating a movement. Folks react more to emotion than they necessarily do to a bunch of statistics. And I come to that conclusion somewhat reluctantly because I am a numbers person myself, but I really do understand the power of stories, and that's part of what I want to explain in terms of how we build the movement and the activism is in basically establishing more of a willingness for more of us to share stories and to potentially get out of our comfort zones to explain why this really matters. For me, it's personal in terms of what I went through from the health, my own health crisis, but it's also it was personal to me in many respects even prior to that, and that relates to a story I tell in the book about my children's preschool teacher who was working in a nonprofit and not earning very much money. This nonprofit was the preschool. It was a community-based organization that served a lot of low-income families, and the organization just didn't have the wherewithal. They could barely pay the staff, let alone provide any benefits. And so this woman, who was a mother of two, was able to get her kids enrolled in Medicaid through the Children's Health Insurance Program, but she made too much money to qualify for Medicaid. This was before health reform in Massachusetts. And when I found that out, and I was wringing my hands thinking, is there anything we can do for her? I felt terrible that my children are going to this place, and there was just no way we had the wherewithal as parents to have enough bake sales to raise the money to cover her insurance. And most of the parents couldn't afford to pay more out of pocket for this childcare. And so there just wasn't an obvious solution. When I had the chance to come back into state government to help launch the Health Connector, this woman is who I had in mind. I thought, this is how we're going to solve the problem that seemed insolvable to me when my children were very young, because we needed the resources that government could bring to bear. We needed those subsidies so that people who were working in those kinds of frontline jobs that unfortunately are not particularly well paying, that they would have the healthcare that they deserve. And so I jumped at the opportunity to go back into government and try to make this work. There are so many stories like that, and I tell more in the book, some of which have tragic endings when people don't get the health insurance coverage in time. Moving on to the next. Something else I talk about in the book is that, as much as I think there should be a national policy around universal health care, we are very much a country that allows states to do their own thing to a certain extent. And so some of the efforts have to be made at the state level. And so I like to make that distinction. And if I show the next slide, you can see that one of the pieces of the Affordable Care Act was the choice, not intended, it's the result of the Supreme Court decision in 2012. So now states have the option to expand their Medicaid program and basically raise the bar from being extremely poor to being moderately poor to qualify for Medicaid. And so when that was left up to states to do, the majority of states chose to, and back in 2012. And then over time, more states have come in. The federal government is initially offered 100% funding, 100% federal funding for that expansion group. It's now down to 90%, which is where it has stayed. So it's still the vast majority of the money. But even when it was at 100%, there were states that outright refused to expand their Medicaid programs. And as you'll notice, most of those states are in the South. It's the orange states here. And that includes Texas, which has the highest rate of uninsurance in our country. It's 18% right now. And then some of the states in the Midwest. Although a very encouraging sign is that 2 states this past summer, through ballot initiative, passed Medicaid expansion. So Missouri and Oklahoma came into the fold, and so they now will be moving forward with covering more of their population, which was extremely good news and was the result of a lot of grassroots efforts and work that was done on the ground in those states, but was helped along with funding from donors from all over the country. Moving to the next slide. So states really vary in terms of their health insurance coverage levels. And so there is a tremendous range. As I just noted in the previous slide, Texas has the highest rate of uninsurance in the country at this point at 18%. The US average is 9%, and the winner is Massachusetts. Our uninsurance rate crept up to 3%. Again, we'd hit the all-time low of 2. We're at about 3 right now. So there's a tremendous range depending on the choices that governors and state legislatures make. Moving to the next slide. As I mentioned, the Medicaid program was designed to allow states a lot of flexibility. In fact, when it was enacted back in 1965, the states actually didn't even have to become part of the Medicaid program. It was completely at state option. The federal government funds roughly half of the program to a basic level, although in some states it funds a higher percentage. So it took actually 17 years. It took till 1983 for every state to opt into the Medicaid program. Arizona was the last. And it still allowed states a lot of discretion in how they set the eligibility levels and criteria. So for example, in some states, you can't get Medicaid if you're a single individual. You have to be a member of a family. So what the Affordable Care Act was trying to do was to level the playing field and get all states to have Medicaid for family, and I chose a family of 3 as our example. They raised the bar to being that a family of 3 would need to have an income of just under $30,000 to qualify for Medicaid. But in all of these states that have not yet expanded the Medicaid program, the bar is significantly lower, which means there's a big gap between the income that the state's requiring you to have and where the federal government would allow a state to expand to. So again, I'll pick on Texas. Their income cutoff is just under $4,000. That's annual income for a family of 3. If you make less than $4,000 in Texas, you can be on Medicaid. If you're an individual, you cannot be on Medicaid. There is no health coverage for you. If you're in between that income level and the 28,000 here on the chart, then you are, as a family of 3, have no option other than showing up at the ER. But you have no health insurance coverage. Once you're above that income threshold of 28,000, then you can qualify for subsidies on the health insurance exchange through healthcare.gov. So that is a significant gap. That is why we have an 18% uninsured rate in Texas. And it's a little less bad in some of the other states, but frankly, it's pretty jaw-droppingly bad because we're talking about extreme poverty. And so most of the folks who are uninsured and fall into that gap are working folks. Moving on to the next slide. Again, wanting to dwell in optimism, I wanted to show that there truly is another way. And how I wrote the book was to showcase states that have really stepped up and done more, and also other countries. And reflected a lot on what it would take for this country to do that. And again, concluding that with the right amount of activism and setting a different kind of expectation, we too could be a country that makes healthcare a right. We're the only developed nation that has not made healthcare truly a right. All of the other developed countries have done it. However, they all do it in different ways. So I go to the next slide. I picked, so for those who really want to get wonky, the best source for all of this information about what other countries are doing is the Commonwealth Fund. And they've got a phenomenal website, and you can pick your country, click on the flag, and you can see all the things that the countries are doing in numerous regards for healthcare, from coverage all the way to true access into the system, and then how payments are structured and all of the pieces. But to try to boil that down and simplify it a bit, I chose 3 countries to talk about in the book: the United Kingdom, Canada, and Germany. And each of these countries, and then of course I put the US in there so you could see where we stand. And I've put the framework out there of a continuum. So what I wanted to convey is that there are, again, so many ways to do this. And the amount of government involvement can really vary. So a lot of times Americans will think, well, there is no other way unless you want to be like England and have like total government control. Well, that's actually not true. We could be like Germany, or I could have picked Switzerland or the Netherlands. Those are countries that have chosen to retain a strong role for the private sector, that put a lot of value on competition, have private insurers offering coverage, have private doctors offering care. And are not fully taking over the whole healthcare system and all the decisions. However, there is a government role in creating guidelines, boundaries, requiring that everybody have health insurance, just like the ACA requires coverage of pre-existing conditions. Potentially setting prices of what's going to be provided, but still offering a lot of choice. So I described the model of Germany because I think there are a lot of things that we would benefit from understanding better about what they're doing. And in terms of the continuum, it's a little more analogous to where the US is actually with the Medicare and Medicaid programs, which are government sponsored and funded, but have significant amounts of private sector involvement through the way the insurers are operating and various other things. So that's one framework, is the amount of government involvement. And then, as I've been alluding to, how many payers or insurers are involved is another dimension. And in the UK, you have a true single payer system. That is, the government's collecting the money, the government's paying the bills. Canada is not quite as far to single payer as the UK is, but is close. Again, Germany's more in the middle, and then the US, depending on which program of coverage you're looking at, is a little less so. And with employer-sponsored insurance, that's what ESI is, being the least regulated, the most free market, if you will, of the coverage options in the country. So there is no one way to design universal health care. Every country's gotten to there in their own way. So there are many paths, and I want to break people out of that sort of lockstep framework of, well, we can't be like England. We don't want the National Health Service determining, what our coverage is going to be. It does not have to be like that. Next slide. I also wanted to throw in, for context, while I'm mostly focusing my remarks on universal health care, as you all know, being students in a school of public health, there's plenty of other things that drive our health outcomes, both individually and as a society. And if you all haven't read Dean Galea's book, I'm going to put a plug in for the book Well, which I read just before I was wrapping up my manuscript for this book. And I thought it was a tremendous jewel of a book that really clearly lays out all of these other contributing factors. What I want to call your attention to is that basically spending on health care is done at a disproportionately high level in our country, and spending on other things like social services could actually be a stronger contributor to better health outcomes if we were to recalibrate and redirect some of the money that's going into straight traditional healthcare and push that over into social services, so that the ratio of spending looks more like it does in the other countries. We have about a 1-to-1 ratio on what we spend on healthcare and what we spend on social services. Other countries have something more like a 2-to-1. I should say it the reverse way, spending more on social services relative to what they spend on healthcare. And so that is something that needs to be looked at in terms of how we think about our budget priorities. Next slide. And then beyond that, or maybe double clicking, to just give one example, I could have taken many sorts of benefits, but if you look at maternity leave at an international comparison, again, looking at all the other developed countries, they have some form of paid maternity leave for all of their citizens. Paid maternity leave that does not depend on who your employer is. It is a universal benefit. And it tends to be around 14 weeks of coverage, contrasted with the United States, which has 0 guaranteed paid weeks of leave. We do have 12 weeks of unpaid leave, thanks to the Family Medical Leave Act that was passed a few decades ago. And that was a tremendous fight to get that passed. And it does entitle people to some time off, but only those who can afford to take the time, take the time. And so this is another example of where we significantly deviate from other countries that has direct impact on our collective health. So there is another way. Looking to what other countries are doing, bottom line, is really important, and thinking about shifting our priorities, not just for universal healthcare, but other forms of benefits that provide health benefits ultimately, I think is vitally important. Moving on. So where does that leave us? I say bring on the activism, because once you see this, I think you can't unsee it. And particularly, and we'll talk about this when I'm in conversation with Professor Gordon, but we are in a pandemic. I mean, there could be no more important time to be considering truly making healthcare right in this country. I think it's absolutely essential. It won't solve the pandemic, obviously, but we would be so much better off as a country if we would tackle this at the same time while the spotlight's on healthcare. So moving to the next slide. I'm inspired by many of the people who've come before us, and Angela Davis is somebody whose quote I saw during the first Women's March that I attended, and I love this one, that I am no longer accepting the things I cannot change. I am changing the things I cannot accept. Moving to the next slide. I think it's easy for people who may not be as inclined to think of themselves as activists to say, well, I don't know, I'm not comfortable with that, or really, what difference does it make? What can I do? So I love to also include this quote that I find inspiring by another one of my heroes, Alice Walker. The most common way people give up their power is by thinking they don't have any. And that was what was so astounding about the Women's March, was that all of these people who came, and a large percentage had never marched in anything before, including my 80-year-old mother who was with me. And they looked around and said, oh my gosh, I didn't know there were so many people who felt the way I do about this. And it was incredibly physically empowering to feel that. And so it drove this point home for me, that you can't sit in isolation, and particularly during this pandemic where we're being forced to be more isolated. And that's having a lot of deleterious effects on us and our mental health and all kinds of things. We can't let ourselves get into that disempowered frame of mind. We can't let our power be taken away by thinking that we don't have any, when in fact we do. Next slide. And so to help step up our confidence, which especially for women, it's been documented, a lot of us have a confidence gap, whether that plays out in the professional world or in terms of who thinks that they are qualified to run for office, or any number of dimensions. I love Justice Sotomayor's quote that a surplus of effort could overcome a deficit of confidence. And effort is not something to be afraid of or to shy away from. And from that, when you start to see results, you can start to build up increasing levels of confidence. Moving to the next slide. And with that, one of the really positive outcomes of the series of women's marches and other forms of activism is that more women did, in fact, sign up to run for office and went to trainings and learned what they had to do and what it took to raise the money and be the candidate. And the result is that more women ran for Congress. They didn't all win, but the upshot was that we had a record-setting number of women come into office that year. And so now, and this is the celebratory picture, which I love, we now have 24% of Congress is female. That is obviously a far cry from the half the population that we make up, but that was still nonetheless a record. And that was at the 2018 midterm elections, very much motivated by a reaction to what had happened in 2016. Moving to the next slide. And so to come towards the end here, I again turn to a civil rights hero, Rosa Parks. And as she said, to bring about change, you must not be afraid to take the first step. We will fail when we fail to try. And so I take all of that as tremendous inspiration. If we move to the next slide, you can see, to sum up, 4 steps that I recommend in the book. And first is to have the vision, to imagine and dare to dream of a better world, not give up, but dream of that world, and then participate is the next one. As they say, democracy is not a spectator sport, and we have a tremendous opportunity in front of us to participate. In about 2 weeks, less than 2 weeks. The next is to enjoy. And I think that's really important to not get burnout and to find the ways to really work with people, make the friends, which is what happens when you engage in activism. You will find that to be empowering on multiple levels. And if you read the memoirs of people like Angela Davis, or hear her talk actually, or Gloria Steinem, also still giving talks to this day and encouraging activism. They fought lots of hard battles. They did not win all of them by any stretch, but none of them would trade doing what they did for anything else. And part of that is because of the people they got to meet and work with along the way. So I find that very inspiring. And then ultimately, the 4th step is you do have to persist, because it truly is a marathon. It's not a sprint. And so you do have to pace yourself to a certain extent and know that you're engaging for the long haul. You can take some breaks, but we don't want to give up. We've got to push. And so in terms of some specifics, if that's a little too high level there, I'll close with this next slide to give you some very concrete actions you could take right now if you're sitting on your computer and saying, okay, I hear you, what can I do? I have a website, and on that website, I have all kinds of links to where you can sign up for different organizations where you can contribute your time or your money. And I also have a personal activism assessment, so you can gauge where you are, and then that will help give you some tips as to where the best fit might be for you in terms of involvement. I also really encourage you to do this with friends and spread the word, share the message, pick 3 people that you can talk to. And then I will be continuing to write and blog and encourage as time goes forward, regardless of which outcome we have with this election. I will never give up on this. And so if you want to follow what I'm thinking and saying, you can sign up for my email list. And then in true closing, I have my contact information, and I'm on social media and all of those things as well. Of course, if you'd like to buy the book or do something like that, that would be wonderful. And for anybody who signs up for the email list today, we will be giving out a free book. We'll do a raffle for a couple of free books. So encourage you to consider signing up, and maybe you'll get a book. All right, I'll leave it there. Thank you so much for the opportunity to speak to you all. It's truly an honor, and I look forward to our discussion. Thank you.
Thank you so much, Rosemary, for that wonderful presentation of these really important issues and the central themes of your book. So there are a ton of questions coming in through the Q&A. So I'm going to start with a question that I had, and I also try to combine it with a few of the questions that we're also receiving. So we'll see how this works.
Great.
But given your expertise as Deputy Director of the Massachusetts Health Connector, which the ACA was based on, I'm curious what you see as the major shortcomings of the ACA. And then there are a few questions that I think really speak to this concept. So one attendee asks, is all coverage equal? Is all different types of coverage adequate? And similarly, another attendee asks about how the existence of areas with professional shortages in terms of healthcare services and providers might affect both insured and uninsured people. So I think that sort of, if you could try to address those questions maybe in the context of what you see are the limitations of the ACA.
Okay. Well, one of the ACA's biggest shortcomings was not by design, and that's the one that I spent the time on with the slides, just to show that this choice of Medicaid expansion is having really significant and harmful impacts. And that was, again, not how it was designed, but it's where we are. And it's something we absolutely have to pay attention to, because it's having disparate impact racially as well. When you think about who's uninsured in the South, it's disproportionately African Americans, people of color. And so along with being disenfranchised and still in so many ways today, they're also going to be suffering tremendous harmful health effects by not closing this gap. So that was a very unfortunate thing, which I think is something that a new administration could try to address, certainly by putting some more funding on the table for states who would like to opt into closing that gap. So that's a shortcoming. Also, the ACA, frankly, yes, it had subsidies on the sliding scale, but the subsidies aren't as generous as what we did in Massachusetts. So they're not as robust. And that is unfortunate. And it's something that the Biden-Harris platform is seeking to address, to basically amp up the amount of those subsidies. And that would truly make the coverage more affordable. It also, well, I'll leave. There was also the stick parts. The carrots are the subsidies, and the stick is the requirement to have some form of health insurance. And that's trying to make sure that healthy people buy in, even if they don't think they need it. And that helps keep all insurance costs lower, because the risk pool has more healthy people in it. That the jury's out a little bit as to the efficacy of that mandate. We've had it in Massachusetts ever since 2006, and there's studies that show it's very effective. It's become extreme political issue at the national level, and it's something that the Republicans zeroed out. And so we're now running the ACA without it. And so we'll have to see whether that really mattered in terms of the risk pools. What the ACA was unable to do was really tackle the high costs that underlie our healthcare system, and why we're spending twice as much as other developed countries to get less results. A lot of it is about our prices being higher, and it did not go after changing the fundamental pricing structure. It allowed for a lot of experimentation through the Center for Innovation, but it didn't require things. And so there's a lot more that could be done there to help lower system costs, or at least keep them from growing so much, in order to keep the whole enterprise more affordable. So those were some of the shortcomings. I think also, frankly, the education and outreach process for the ACA was, as much as they tried, it was still limited. And in a sort of bizarre twist of fate, people have learned more about the ACA when it's been on its death, in each of these near-death experiences, like the threatened repeal in 2016, which bled into 2017. I mean, people came out in droves, led largely by women, to town hall meetings to say, you have to protect people with pre-existing conditions. Well, that was not a term that had rolled off people's tongues prior, but once people had the protection and understood what it was, they came out to tell their stories and protect it. So while the original ACA, I think, didn't do enough, the fact that it existed and enough people got covered and began to understand that it was very effective to get the message out, to the point where Republicans campaigning this year, including Trump, are not talking about, well, let's just say they are claiming that they will protect people with pre-existing conditions. So they're no longer trying to take that piece off the table because they've seen it as so politically popular across the aisle. So that's some of the ACA shortcomings. In terms of all coverage is not equal, and I alluded to that with employer-sponsored insurance, you have people who are technically deemed underinsured. In fact, a quarter of folks, according to the Commonwealth Fund, about a quarter of folks with employer-sponsored coverage are technically underinsured, which means they can't actually afford the out-of-pocket expenses and to be able to use this insurance that they supposedly have. So it's mostly for them just truly for catastrophic coverage and not all the things that they need in between. And so that's a growing number. It's over 40 million people in the US prior to COVID and probably bigger now. And so that also has some of the same harmful effects as being outright uninsured. So there's tremendous variation in coverage. And as many people, even, middle-class people who are relatively comfortable compared to lower income people, are feeling every year with open enrollment, the value of their benefits is eroding and eroding and eroding. And so I think this issue of affordable universal healthcare has gotten the attention of the middle class in a way that wasn't true a couple decades ago. Shortages of providers, I think, was the other piece of the question. And I know, when we passed health reform in Massachusetts, there was concern, well, if all these people flood in, there won't be enough doctors to treat them. And that didn't turn out to be so true. And in fact, it's not like people all need to go running to a doctor. A lot of things that people need can actually be supplied by other people in the healthcare system below the level of doctor. It could be, just having a routine checkup that a physician's assistant and a nurse practitioner are covering, or things like that are really more at that front end of prevention and doing basic care. So we did not end up running into some major problem with that in this state when we rolled things out. Now, obviously, with coronavirus, we're experiencing unprecedented levels of distress and peaks in needs, in hospitals that had not been having all their beds filled for so long, and that's turning around. So there are going to be pockets of places where it's going to be hard to have access. But I think the healthcare system is rallying and trying to find ways to be creative. And we could go on and talk about telehealth and things like that to try and mitigate some of those surges and the distress that's causing in the system.
Yeah, those are all really important points. I want to go back to what you were mentioning about the trade-offs between the individual mandate and affordability, because I just think a lot of confusion surrounds the individual mandate. It's gotten a really bad rep, and you heard it even last week in the Senate hearings. We want to keep protections for pre-existing conditions, but we want to do away with the mandate and replace everything else in the ACA. And that's a really easy thing to say. It's a really easy stance to take politically on the face of it. We don't believe in forcing Americans to buy anything. That's a restriction of our freedom. But it's a lot harder to get the numbers to work without it in terms of affordability. So I wonder if you could just speak to, why is the individual mandate so important? Why do you think it's such a hot button issue for Americans? And how do we explain why it matters? I mean, is it possible to do what the Trump administration is proposing, which is to keep protections for pre-existing conditions, but do away with any sort of mandate for insurance?
No, it's not possible. If you make healthcare coverage universal, there are different ways to do it. And the mandate is one way, but another way would be to say it's like Social Security and everybody's just going to pay in a little bit over some long period of time, or frankly, how we fund a significant portion of Medicare is people are paying in, and everyone's required to pay in. So then you're all in. And maybe that's not called a mandate, that's called a universal coverage program. But you do need to have a robust risk pool, because when you don't, and there are states that tried to do that and not really and they ended up creating these high risk pools to put the folks in who they were saying, okay, we're not going to require everyone to have insurance, but those people who are sick and really need it, we'll put them over here in this high risk pool. And they were always woefully underfunded, and there were long wait lists, and all kinds of folks had no access therefore. So it was an idea in theory, and I understand, I've been following one of the campaigns in Colorado, where the one senator, Republican senator, saying that that's what we could do. And, but the history doesn't bear it out as to ever really working for everybody. There is a universal need. And partly why I lead with the first slide is that a lot of times people, especially younger folks, don't think they may have that need. So it's kind of easier to say, okay, well, I'll take my chances. But this sense of you yourself in the arc of life will need it. And then I also want to encourage some sense of social solidarity, which I would hope, in this pandemic, more people are understanding that our health truly is interconnected. Now, of course, the media is going to show the folks who are absolutely taking an extreme, no mask wearing, kind of frankly self-righteous position, which is so harmful to the rest of us. I do believe that's the minority and really an extreme, and that most folks are trying to just get through this and are understanding how much more interconnected we are. So I do think there's some opportunity there, but there has always been a tradition in our country of this kind of individual rights. But it's coupled with responsibilities. And, a lot of people in the military, and I have a quote in the book about that, people in the military understand that with freedom comes responsibility, and there are so many examples that are part of our culture that actually underscore that independence, and are coming together. And some of the leaders we've looked up to, how we got through the Great Depression under Franklin Delano Roosevelt, was really about having leadership that brought us together more than driving us apart, and finding our common humanity and building from the suffering to a better place. And so we have a history in our country of that as well. And that's what I want to amplify.
So to also dwell in optimism and to assume that there is a path forward to meaningful health reform, I think reading between the lines in your book, and maybe not so subtly, it seems like you lean towards a Germany-style managed competition Medicare buy-in, type of plan. So I think a natural question for you is why is that your choice for what could work here in the U.S.? How does that fit with what we already have? And of the plans we know about, right, of the Biden-Harris plan, of the Warren plan, the Sanders plan, where would you, if you were the one who could give one of those plans the green light, which one would you do that for?
I came down with something more like Biden-Harris plan, and it's because of, so let me just say, I truly admire the spirit behind what Bernie was trying to do and what Senator Warren was trying to do in the spirit of Medicare for all. And that truly was to make it a simple, healthcare should be a right. We're in this all together, and we just need to go this path. And I agree with that. We're in this together, and healthcare should be a right. I 100% agree with that. The part of what I was wrestling with in writing this book was my lived experience, even in a blue state like Massachusetts. There was no way that this state would have accepted something that was like a Medicare for all back when we did health reform. And frankly, I don't think the state would even accept that today. But, maybe that would change a little bit with the pandemic, but even in a blue state. Now, I worked all around the country with red states, purple states, kind of everything in between, and saw how our kind of Commonwealth of Massachusetts values were maybe not shared in the same way in some of these other states, and that they were implementing the ACA, but simply because it was the law of the land, not because there had been a work on a grassroots kind of universal buy-in to it. It's like, well, if this is what we have to do, this is what we have to do. And I was trying to show, well, here are the bright spots of that. This is how it'll be good. But a lot of hand wringing and all of that. And that was to do something that was so far short of a government takeover of healthcare. It was really keeping insurers at the table, giving citizens choices that didn't look like governments taking, control of your healthcare decisions, but you will still have a Blue Cross Blue Shield in your state. You will still have your Medicaid managed care organizations. They're all right there as your trusted partners. That was incredibly important. And so I didn't see it so much as of course there's, in lobbying groups and what have you. We could talk about the hardcore politics in DC, but what I was experiencing was the more on the ground, state by state, and individual reluctance to cede too much control to government around healthcare decisions. And we also saw that when President Obama had promised folks that if you liked your healthcare coverage, you could keep it. And he said that, and then there was a little piece that was actually, through the ACA, was to enhance some healthcare coverage that people had that was frankly skimpy insurance. And the idea was meant with, it was benevolent intentions, but it was to basically raise the bar and include all these essential health benefits. Well, a lot of people who had their insurance that didn't include all those benefits said, I like it fine, and you told me I could keep it. I don't care if you think it's better. I want to make the choice. And he was really, really strongly criticized politically for this, and they had to retreat. So I also lived through that, and that was a very scarring experience, I think, in the rollout of the ACA. And I don't see, even with the pandemic, I don't see some of those fundamentals changing. There's this notion I talk about in the book of path dependency. You can't totally start from square one. You have to start from where you are as a country. That's a lesson you learn from the other countries. Very rarely do you get to start over. So you've got to work from where you are. And then I call it, I didn't coin the term, but this notion of radical incrementalism. So the radical idea, shouldn't even be radical, but is making healthcare a right, and then taking strong incremental steps to get there that our country can digest, so that we don't end up rejecting the forward progress.
Right. And I think a lot of I think you alluded to some of the lack of effective communication around the ACA, which I think it did get phased in. It wasn't an immediate change, but the fact that I think there wasn't enough information and people weren't completely bought into it, that helped, it sort of skidded right when it was getting off the ground.
Mm-hmm. Mm-hmm.
So I want to transition now just to talk about women, because that is a central component of your book. And you make the case that women are well positioned to lead the fight to make healthcare a right and to move us towards universal healthcare coverage. So I want you to talk a little bit about who you were imagining as the audience when you were writing this book, and why you think women is the right group to take this fight all the way.
So one of the statistics I share in the book is that women make 80% of the healthcare decisions for their families. And again, pre-COVID, but we are seeing how much of a burden, frankly, women carry for the health and well-being of their immediate families, and frankly, for their closer and extended communities, families and friends, and especially in a pandemic when the needs are so great. And so the idea that women are carrying this burden, if you will, is what I also want to turn into a strength. And so if what we need is to get more political power, we've got to have some of that emotional energy. And frankly, one of the books that informed my book was called Good and Mad by Rebecca Traister. I highly recommend it. And she points out over the arc of history how much social change has happened when women have gotten good and mad. And so I want to say, okay, I'm not trying to add to our burdens. I'm actually trying to help them and go back to that notion that the personal is political. And the things, that Gloria Steinem and the early feminists were saying, that is true. These burdens that cannot be solved at the personal level need to be solved at the political level. And I go back to the example of my preschool teacher. She was carrying such a burden, my kid's preschool teacher. And that wasn't something that she could solve by working harder or doing something else, nor that even I could solve as part of her immediate community. It needed the wherewithal of a systemic solution. And that only comes about with the political pressure and political change, because the systemic solutions in the healthcare arena have to have a government component. So you just can't take politics out of it. So I figured take that energy, that good and mad, which I saw fuel the women's marches, but keep it on that positive path. I really believe we can do it.
Yeah, in your book, you also call for, I think the phrase is seizing moments that foster a fierce urgency of now. And right now, people are really, really angry, especially women. I mean, there are so many events in the world we are living through that have helped to cultivate that urgency, from the COVID-19 pandemic to racial inequality and injustice, to the shocking rates of women who are dropping out of the job market, to the appointment of Supreme Court Justice, and of course the election. I mean, that list is already, boggles the mind. So I'm wondering, we have this urgency of now, and we have all this anger. What are the first steps you would say potentially to someone who has not been super engaged in these issues, and how they could start to get involved in their own community?
So as I suggested towards the end of my remarks, first of all, don't do it alone. Find a friend, bring a friend, because I do think it's hard. Sometimes there's so many reasons to do that. And in the professional world, or even actually in my writers group, you talk about having an accountability partner. So it's always good to have someone who's good at, like, if you say, I really want to do this, and they help keep you honest, like, okay, I'll do it if you do it. And you, it's like how sometimes people get studying done too. It's like, and working together. So that is a really important step, is to don't do these kinds of things alone. It's going to be a lot more fun and a lot more sustainable if you're doing it with other folks. So there's that, and you can build, frankly, that adds to the collective action. So you're actually enhancing your own power by bringing others in, and into what? Well, first of all, is making sure you're really informed. And I talk about being a healthcare voter, and knowing who is supporting a healthcare platform, and pushing to make it universal healthcare. And so that's one piece of it. But also, being informed enough then to have conversations and bring other people into it. And as the holidays approach, although we may be having virtual Thanksgiving dinner conversations, but there's always that kind of the loud uncle at the table or something who's like, well, we can't afford it in this country. Well, with this book, I'm arming you with information that says, in fact, we can afford it, and we can't afford not to. And here's how we can do it. So you can have a sane, hopefully civil conversation, and not shy away from that. Because it's a question of changing hearts and minds one by one, and sharing a story. That's another thing. If you know somebody with a pre-existing condition who would be vulnerable, you tell that story. That's a lot of how I think attitudes collectively towards the notion of gay marriage came about, because there were so many individuals who were affected by friends and family. In my lifetime, that has changed profoundly in terms of like social acceptance, if you will, to where, my kids are experiencing life totally differently than I did in college, and certainly my parents' generation. And that's about lots and lots of conversations and experiences that then start to change what is considered politically possible, because the culture starts to change. And so I want the culture to change to say healthcare is a right, just like K through 12 education is a right in this country. And so even if that's all you can do, that's a huge start if enough of us do it. I then encourage people to consider where you're making donations, and a lot of women don't make political donations. Men make 2/3 of them. Women make 1/3 of them. That makes it harder for women to feel they can run for office. Am I going to be able to fundraise? That's starting to change, but I just want to shine a light on where are you going to put your priorities? And I say make systemic change. And that has to be through politics, not through nonprofit organizations. Even though I'm a huge fan of nonprofits, they're often putting the Band-Aid on downstream, and we need to deal with a lot of these systemic upstream things, including, universal health care. So those are some of the things. I have a longer list. It's all on the website.
Yeah, so I want to wrap up with on a positive note with a last question of how your prescriptions for activism might change specifically for young people. I imagine there's a lot of young people who are tuning in right now, and I for one find it extremely hopeful that this generation of young people, particularly Gen Z, those who are born after 1996, are one of the most politically engaged generations. They're more progressive, they're typically more pro-government, and really, really engaged. And so we've seen the power of young people, and particularly with social media. I mean, there's so many recent examples with high school students from Marjorie Stoneman Douglas High School registering hundreds of thousands of people to vote, Greta Thunberg becoming a global icon for climate change, and the fact that it was a 17-year-old girl who videotaped the murder of George Floyd. And so it's interesting because I haven't really seen the movement for healthcare transition into that space among young people, some among Bernie supporters, but and spreading across social media. And I wonder how we make this issue really real, so young people can get engaged in the ways that have already been shown to be so successful.
Yeah, so Bernie certainly had rallied so many young people, and I think that the Medicare for All chant really had captivated folks, along with the idea of free college and other things like that, which are very appealing, and I think, frankly, should be given some very serious consideration as we look at tremendous rise in inequality in this country. So. I think that this notion of government having some role, but maybe not the full takeover, and trying to say the sign to hold is make healthcare a right, but leave it potentially to the folks in DC who can navigate, the Nancy Pelosi's of the world, who understand the ins and outs of the politics. The realities, even if you end up with a Democratic majority, a lot of those Democrats, if that's what happens, after November 3rd, they'll be coming from states that are not like big blue states. They will be having to straddle some middle ground, and that's where Medicare for All starts to fall apart. But we could still say healthcare should be a right, and young people can really, really push for that. I think they have less discomfort with government playing a role than folks who are middle-aged do. Older folks seem okay with Medicare. They want to protect that. So it's funny, you've got younger folks and older folks like, yeah, government has a role, but it's the folks in the middle still holding out and leaning the other way. So I could have written this book to rally young people, frankly, because the statistics, as you point out, look so good. So I would say you can take a lot of the same lessons from the book, and young people can put their own stamp on it, and TikTok it away, or my kids will be laughing like, that's not how you say it, Mom. But social media strength can be harnessed, for good or not, but let's harness it for good. And I really admire the young folks. And it's partly why I lead with that first slide again, because sometimes the problem for young folks is they won't see themselves, they may think they're invincible and not really need healthcare so much. So it's kind of trying to point out, well, you will at some point. And it's all a bit of a crapshoot, frankly. So trying to just inform folks about that too. But
yeah, and I think it's so easy to get bogged down in the details. It's why I really liked, but honestly struggled a little bit as a policy wonk who's very in the weeds with thinking about the details. But, you say that an activist agenda doesn't have to have a specific policy. You don't have to get behind the Biden plan, right? You can speak to a general message about healthcare being a human right, being something that we believe everyone should have access to. And that is such a powerful rallying cry. And I think we split hairs over these different types of plans, which I actually think is a distraction.
Thank you. It is, and it's something, in the lessons learned of like the Clinton era, it got so complicated, and then there weren't enough people in the grassroots pushing to keep it happening. So it was kind of easy to just have it fall apart in Washington, and there wasn't, when a lot of people have said that social movement aspect had gotten disconnected from what was happening in DC. And so that's where I want to keep the connection. But I think about it a little bit like being on a board of directors, where a board will say, this is the direction we want an organization to take. Management, you go work out the details, but we're setting the direction. That's what I think we should be doing as voters, and saying, we're setting this direction. And Washington can work out some of those details. We don't have to know all that, because otherwise people get intimidated from the topic, and I don't want that to happen. So, yeah.
Yeah. So I think we are nearing the end of our time. There are lots of questions that we didn't get to, and I'm so sorry that we didn't have a chance to answer. I think I could have this conversation all day. There's so many dimensions at intersections between different movements, which I wish we could talk into. We barely, even scratched the surface on the pandemic. So it just means we'll have to have more conversations. And I think this is the perfect time to be doing it. There's never been more momentum behind this. And so we, a lot of it hinges on what will happen in November.
Absolutely. Well, we talk about, I think our country's in a bit of an embarrassing situation. That's putting it mildly right now. We love to see ourselves as leaders in the world, and we are falling so far behind, but we don't have to. I mean, we really have it within our capacity to do better. And I'm pointing the way for one of those paths. We've got several things we've got to do, but this is one where we have fallen short even before the pandemic, and the pandemic's only going to show how much more harm we're suffering because of it. So,
yes, and you have to believe that we can do better. I think that it's easy to throw up your hands with healthcare, but you have to stay in the fight, and I feel like your book makes such a compelling argument for that. So thank you so much for having this conversation with me. It was wonderful. I'm now going to pass it back over to Dean Galea to wrap up.
Thank you.
Well, thank you very much, Professor Gordon. Thank you, Sarah. Thank you, Rosemary. This was what an extraordinary conversation. For a conversation to range from anger, from sort of the justifiable anger of the moment, to optimism, and then back again. I think that's not an easy feat. I could have listened to this conversation for several more hours. I thought, Rosemary, that the conversation did justice to your extraordinary book. I hope you thought so as well. As Rosemary mentioned at the beginning, I had the privilege of reading a preprint of the book and writing some thoughts about it. I think it is a book that really captures the moment beautifully. And I must admit, when I sort of first saw it, it wasn't now through the lens of 2 weeks before the election. And now thinking about where we are now, the book feels more prescient than ever. There is a bit of a trope, I think, that elections come and we say, this is the most important election in a lifetime. And every election, sort of people say that. It might be true this time. And I think it might be true this time from the perspective of health, that there is so much in the balance in the coming election, that the trajectory of what will happen to our health, both in terms of healthcare as well as in the forces that generate health, will be dramatically different in the coming few years, depending on the direction the election goes. And I actually think that Rosemary's book and the ideas in it really point out exactly why this election matters so much. I think, Sarah, you had a couple of calls for the importance of voting as a way of demanding health of the public sector, demanding health of politicians. And it seems to me like that is something that today, October 2020, is something that we should all be doing. So to both of you, thank you. I learned immensely from both of you, Rosemary. I read from reading your book, and I learned more from this conversation. I thought, Sarah, it was a wonderful back and forth. Thank you both for doing it, and thank you to the audience for joining us in this conversation. Everybody, have a safe, good evening.
Thank you.